This video is by Arif Solehuddin, who is a gynae in Indonesia. And in this short reel, he was removing an IUD from an elderly woman. And so he was asking her, like, how old is this IUD? He asked her. And she said it's been inside her for 43 years. And so he took it out, and you can see it's a lipus loop device, which is like a double S. So that's not found anymore these days. So the comments, Anaya said, Doctor, please explain the effects. Why is she taking it out now? Did she experience any side effects from the IUD? And then Salsabila 297 said, Oh, I didn't know that you could wear the IUD for decades. Another person said, Mufida, if there are no side effects, maybe the woman just carried on as per normal. Kaisa said, usually it's because people are afraid to die with foreign objects inside their body. And last one, Reni Hadid said, my neighbor also wore this same IUD like this. It's called the spiral, and she had to be operated on. Yeah, so this was the start of the video. He was asking, when did you have this IUD inserted? And then because she said 43 years, so that's why he was asking like who is the same age as her IUD? Because it's unusual to have it in there for so long. I found some information about the Lipus Loop IUD. So this information booklet dates from 1977, and it's from the company that made it. Here they say that they explain that IUDs are small articles which are inserted into the uterus. The purpose is to prevent pregnancy. How the IUD prevents pregnancy is not completely understood. Several theories are they interfere with the implantation of the fertilized egg, but it does not prevent ovulation, which might make the IUD unsuitable for you. You can pause to read, it's quite a lot. And this is a list of the adverse reactions that have been reported and that may occur. Blood poisoning, septicemia, infection, cysts, fainting, fragmentation of the IUD, it can break, internal abdominal adhesion, migration. So the IUD can move. It can actually leave the uterus and enter other organs or float around, resulting in perforation. Yeah, so if it leaves the uterus, that means it has perforated the uterus. Pregnancy. So although it's intended to prevent pregnancy, it can still happen. And I think I've seen Facebook groups before of more recent IUDs and women who have gotten pregnant despite being on these IUDs, and it happened. I guess it happens often enough that there is a Facebook support group for women who get pregnant while on these IUDs. So this is a diagram of the Lipus loop. It's basically a plastic loop in the shape of a double S, and there are four different sizes from 22 to 27 millimeters, and there's a thread at the end of it that is meant to make it easier to pull it out. The different sizes. Oh no, they have up to 30 mm as well. And they say the IUD might actually come out during your period, so you should check. And a special warning about pregnancy with an IUD in place. Some women become pregnant while using an IUD. If you miss your menstrual period or you have a scanty flow during your period, or if you suspect that you might be pregnant, see your doctor right away. Serious complication of sepsis or severe infection, septic abortion, meaning infected miscarriage, and death have occurred when a pregnancy continues with an IUD in place. Most of the occurrences of these serious complications have been reported in the middle third of pregnancy. That means the second trimester. If your doctor confirms that you are pregnant, he should remove the IUD if the tail is visible. If removal proves to be difficult, you and your doctor should discuss at that time the question of continuing the pregnancy in view of the serious complications that may occur. And reaching a decision as to whether or not to have an abortion, it should be remembered that the risks associating with terminating a pregnancy increase with the length of time you are pregnant. If you're pregnant with the IUD, you can have serious complications. And then if you want to have an abortion, um, if you wait too long, then you'll have more risks having an abortion later. So I checked out some. So I checked out some journal articles, and it seems that there have been other cases where this lipus loop IUD has been left in a woman for decades. So this case report was an IUD left for 50 years. So as the lipus loop was introduced in 1962, it was commonly used from the 60s to the 80s. Some authors state that IUD can be left in there for an indefinite amount of time. Prolonged use of this device was common, however, it was associated with uterine bleeding and inflammatory pelvic disease. The patient was a 74-year-old woman who had urinary incontinence stress. She had two deliveries and already 20 years of menopause. So they did an ultrasound and they found a lipus loop inside. It was inserted 50 years ago. So she went for surgery for incontinence, and they also took out the IUD and did curettage. I guess like scrape the uterus to remove I don't know what. Oh, but the conclusion is 50 years of prolonged usage had no influence on the woman's health. Okay, I thought she came in for urinary incontinence. But I guess their conclusion was that it didn't affect that. And here's another case report of the same IUD left for 40 years and it being the cause of postmenopausal pelvic pain. This case is from Western Ethiopia in a 75-year-old woman. So this study's conclusion is at least that the IUD does carry some complication, such as the pelvic pain found in this woman. Especially because if they're forgotten and they're in there for much longer than necessary, because in this case, this woman must have also had almost 20 years of menopause, and therefore there's no need to be having the IUD if there's no risk of pregnancy. If you don't have menstruation, you can't get pregnant. So there's no need for the IUD to be there. I think, okay, here there's more details about the case. So the woman presented to the hospital with postmenopausal pelvic pain, and they did an exam with a speculum, so which is those duckbill instrument into the vagina, and they saw that there was part of the loop at the external cervix opening, and the loop was easily removed using spongy forceps. And then the patient was given painkiller and antibiotics twice a day for 3 days. Okay, so the conclusion is different. In the absence of an embedment of IUD into the uterine wall or any uterine perforation, that means if the IUD has been in the same place it was meant to be in, then spontaneous expulsion after prolonged use is possible. Spontaneous meaning that it came out by itself. So in this case, they saw like a bit of the IUD was coming out at the cervix. But yeah, here it's also this. They say that while the IUD is simple and safe, if you forget that it's there, it can carry complications. And you should also remove it once you don't need it anymore. Okay, there's more details because this woman, okay, she had 6 children. Her last menstruation was 25 years ago. Okay, so even more. I thought it was like okay, 20, but it was 25 years ago. She had been having lower abdominal pain for 3 weeks. She feels discomfort in her vagina, but there's no protrusion of mass. She can't see anything coming out of the vagina. All previous normal vaginal deliveries. No history of any procedures, surgeries, medical problems. But on examination, she was acutely sick looking. Um, then they did abdominal examination. They couldn't find any mass, any tumors, tenderness. They couldn't find anything else concerning. But then, oh yeah. So when they looked in the with the speculum, that they saw the IUD was like poking out a bit. They said a possible cause of the pain that she was experiencing was the IUD, was the uterus contracting, trying to expel the foreign body. Here they admit it is not easy to remove these IUDs, which are retained for several years, because they tend to accumulate small deposits of calcium, causing corrosion in the plastic. Okay, therefore, we recommend that IUDs be removed at their expiry date or at menopause. So this is from a bidan clinic, Bidan Erma Pemandula. Okay, it dates from 2023, but here it's offering free um 3-month birth control injection. I guess it's free based on some insurance that they can use. But the way that this was marketed was like, okay, first come, first serve, quickly call this number and you can get it free. And the Bidan also posted a free IUD. You have free IUD. You save 300,000 rupiah.